Hi, this is Jim, and for BFR, let's take a look at the total pandemic view, as well as the daily view and the update for Wednesday, August 26th, 2020. We're going to start with the daily report here. And while tests were up over last week, they were still fairly low. We only had 19,000 tests, and that includes the 8% that were antibody tests, so coming in more like around 16,000 tests. So even though cases were on par with last week, we just had 69 fewer and came in at 2236. That means that the positive rate was 12.6%. Now, that didn't drive us back over and into the red again, but it didn't help us stay in the yellow either, and I'll get into that criteria in a couple of slides. Active hospitalizations took a small dip today, and CCU capacity was running at 84%. The CCU data we have here is from Tuesday. Did not have an update by 4 o'clock, so we'll go with Tuesday's data, and you can see the 5 areas there that are above 90%. Oconee's down to 1 bed again, so that is something to watch for in the Milledgeville area. And we just continue to watch as things go on. Region C looks to be up a little bit. And the Kennestone area, that's Cobb, Paulding, Cherokee, and counties in northwest metro Atlanta, they fell below 90%, so they're only at 86 right now. That is good news there. Back onto the daily report, just to look at the fatalities real quick. 49 deaths, that was 6 fewer than last week. Our 7-day average is still fairly high over where we've seen it at 66. Taking a look at the schools, interesting thing today, focus on Gwinnett County. Gwinnett County released a stat with students and administrators with COVID-19 prior to their opening in-person classes today, and they came in at 100 with 100 infected or suspected cases, and then another 137 in quarantine. So something to watch, and it looks like they're publishing daily right now. First, let's see, we had 4 grades go back. I believe that was kindergarten, 1st, 6th, and 9th grades went back today, and then more classes will go back next week. Did hear there was some discussion earlier this week, and I mentioned it, about a potential sick out. If you look at the data, there was a report, WSB Radio had a report around noontime that says if you look at daily teacher illnesses for last year, same day, we're actually lower than teacher illnesses for this year. So a major sick out did not happen. Not saying that all of those are not some people protesting. Other interesting thing on the school list is Tatnall County. Tatnall County has said that masks will be required for school. That has upset a few folks, but all teachers, administrators, and students will be required to wear masks down in that southeast Georgia county. All right, let's go on to the view of the total pandemic view for Georgia. And this week I did some analysis, and if you want to read more about it, I'll put the link in the notes below on YouTube. I wanted to take a look at where are we today on the averages, where were we, how much are we off peak, and then how much are we off of where we were in mid-June-ish when we were seeing lower numbers. So we'll take a look through that. If we look at testing 25,980. This is data through Tuesday for our 7-day average. We're 28% lower, so about a quarter off the peak testing we were doing. But our tests are running about where we were running in mid-July. And then if we go back to mid-June, we're only seeing about 13,000 tests a day. So we are running virtually double on tests from where we were in mid-June. That's a good thing. Now, I don't know how much that will sustain with the new CDC guidance that says, hey, by the way, you don't have to test if you've had an encounter but are not symptomatic. So, with the exception of a few groups. So, that will be interesting to see what it does to the testing volumes over time. Case reports, our 7-day average is currently 2,382 cases a day. As you can see, and I think this chart probably shows it better than others, we were on a downward trend for the last week or so, and it's really kind of flattened out now, at least from a 7-day average perspective. So 2382 is the current 7-day average, down 36% from the peak that was on July 19th, 3,742. If we look back where we are now versus kind of climbing the hill, we were at roughly on par with where we entered July 4th weekend, July 3rd. We had about 2,300 cases on average. And then if we go all the way back to June 13th to that nice flat, we didn't know how good we had it in June. That 777 cases per day on average, that was 10 weeks ago. So if you want to wonder how long this peak has been going on, it's really been going on 9 or 10 weeks now, because once we got past June 13th, we started climbing the hill, and as I said, by July 4th, we were already averaging 2,500 cases a day. Onto the positive test rate, that's in the purple on the bottom left there. Positive test rate, July 12th was the peak, 16%, so that says something about capacity, and we know we've added a bunch of capacity since then. The 825 average is 9.8, and if you look at today's, it was 9.6. Our June low was 6.1 on June 10th, so that is a little bit of a trough there. That was when we had, if you look at that little peak, that was around the 1st of June. That was during the time when they were starting to count antibody tests as viral tests, and that's kind of changed the average there. Actually, to be 100% correct, they changed in June from counting viral tests or from counting antibody tests as viral tests in the total percentage, and that's why we had that little spike and then it came back down. Okay, over to average hospitalizations, 184, on par with July 10th. That's about 7 weeks ago, so everything in the last 7 weeks has averaged above this. Our peak was 301, so we're down 38% from the peak, but we certainly are not down to the 83 per day run rate that we were seeing in the mid-June timeframe. If we take a look at the fatality data now, we're going to see that we are still in that high range. We're actually at 66 deaths a day. That's down just 6 or 7 from the peak of 83 2 weeks. 73 per day 2 weeks ago. We were at 61 deaths a day on August 11th, so we do continue to be near peak on this statistic. Mid-June, we were 41 a day. That was in that little lift we saw there. But if we look down at the low for deaths recently, that low was on July 9th. We were down to 12 deaths a day. So that would be nice to get back to. But we are 4 times higher than we were in July for the average deaths a day at this point. So hopefully we'll start to see this number come down soon. When we tie that number to the mortality rate, the interesting piece is you can see that broad sweeping decline that happened in July. That's because if you compare it back, the cases were ramping up. So cases ramped up. Some of the deaths didn't happen yet, so that has declined. We got as low as 1.93% mortality rate, and mortality rate is number of deaths divided by number of cases. So 1.93% was the low. We've crept back up to 2.04% now, as we've been in this spike of deaths over the last 3 weeks or so. CCU capacity, that has been up above 80% since July 7th. We're at 84%. We had been up in the 86% range, and so we're off a couple of points, but we are kind of materially still up higher in that higher plateau, unlike the bit of a roller coaster we see for the patient beds in use. July 20th was when we peaked, 3183. That was almost 1,000 higher than Tuesday's report of 2260. July 9th was when the state was at 2310. So if you take a look, we accelerated a lot faster than we're declining on patient beds in use, because we went from July 9th at 2310 to July 20th at 3183, and now we've just come back down in the last 5 weeks or so to be at that 2300 level. So 2 weeks to peak, 5 weeks to get back down is the way to look at that data. And then CCU capacity I mentioned as well. That takes us on to the White House criteria. This is how, when you hear the news about how Georgia's doing on the White House report card, these are the two metrics they use. The first one is cases per 100,000 residents. That's new cases over the last 7 days. And we had 156.4, which keeps us solidly in the red. Last time we had this kind of number was on July 2nd. So again, we've been through the 8 to 10 weeks in this peak time, if you compare kind of pre-July 4th to now. So basically what we're going to say, unless this number drops significantly, is we had a hell of a summer. From July 4th to Labor Day has really been peak COVID time for Georgia. Percentage of tests, though, this is kind of shows you effectiveness of testing as well as some of the spread rate. We have just dropped into the yellow this week. That brings us down to, I think, 9.4%. So just into the yellow range. We were at 10% since, above 10% since into late June as we saw the spike go up. And our low was, I lost it. Our low was obviously in early June. Okay, last time we were below 10% was June 24th. So again, we're really seeing the July 4th to Labor Day impact of this being at peak. Now, in addition to all of this, something else that somebody brought up today, and I'm not trying to do what somebody called it, fear porn. I'm not trying to do fear porn, but I just kind of want to bring these things up as you're thinking about things that are going on. Now that we're getting out of the summer and into the fall, we're going to be starting cold and flu season. What does that mean? That means the likelihood of spread could be lifted because there's more other stuff going around as well. I think it'll be interesting to see, with masks, with social distancing, with all the other things, do we have a lighter than average cold and flu season because people are trying to protect themselves from COVID and they're keeping cold and flu season at bay as well. It'll be something to watch for. Don't know if which way it'll go, but just planting a seed of thought as we go through the day. All right, that's it for a Wednesday. Hope you all have a terrific day. I will be back tomorrow. Until then, have a nice night, nice morning, whatever the case may be.